Keelan here has obviously quite a large hand wart on the palm of his hand, another periungual wart around the thumb, the first finger, and a third one here around the fourth finger, another periungual one. So to treat these successfully, he's already had 10 sessions of cryosurgery by another doctor and didn't really work. He's tried topical treatments like salicylic acid for 2 months, that didn't work. And he's tried the home freezers, that didn't work. So what he needs now is to put in local anesthetic. We'll put in local anesthetic, we'll surgically debulk it, we'll control the bleeding, and then we'll freeze it. And using that technique, it's much less painful than he's had previously and much more successful. We have about a 90% to 95% cure rate with this treatment with 1 single session. So we're going to do the 3 on this hand. He's warts on his other hand, but we're not going to do those today. We normally only do 1 hand at a time, and we'd only do about 4 to 6 warts at any one session. So this one we're going to use local with adrenaline, because it reduces the bleeding, and for the fingers, periungual warts, I'm going to use local without adrenaline. Keelan, a bit of a pinch here. It's a bit uncomfortable, a bit sore. Try and bear with me. There's a lot of pressure there. Can you feel that?
No.
Pressure there?
No, I can't. Oh yeah. Sorry,
pressure, yeah. Okay, so a lot of pressure, and then a small pinch. Try not to jump. Just bear with me. It's a bit sore. Small pinch. Good man. Oh, you're tough. Okay, so this is the hardest bit. So what we're trying to do is infiltrate in under the wart. Are you right, Keelan?
Yeah,
bit stingy?
Yeah, it's fine.
You're very tough. A lot of people would be given out at this stage. So we're lifting the wart up off the skin, off the subcutaneous tissues, and you can see it's starting to go a little white already. So I'm trying to go almost into the wart as well as under it. So that's the local anesthetic in there. Now this one is local without adrenaline, so it's just 1% plain. Now the same thing here. I've already cleaned the skin with methylated spirits and some chlorhexidine. These periungual warts are difficult to treat. If you go too hard, you're going to damage the nail, and if you don't go hard enough, you're not going to clear the warts. So we're just putting the local anesthetic in around the nail. This is a stingy, yeah?
Yeah.
You right? Can you stick it?
Yeah.
You sure?
Yeah.
Okay, tell me if it's too much and I can stop, right? So the secret with local anesthetic is to use the smallest needle possible. This is a 30 gauge needle, and to inject slowly, and to have the local anesthetic at room temperature. If it comes straight out of the fridge, it's a bit more stingy. And the local without adrenaline tends to be less stingy than the local with adrenaline. But that's not a major factor. So that's numb. So now one last one, Killian, can you stick it?
Yeah.
Okay, so a bit of pressure here. I've already cleaned it with the methylated spirits and the chlorhexidine, so a small pinch here. That's good, well done. Bit stingy again?
Yeah.
Can you stick it?
Yeah.
Okay, when you had it frozen before, was it very sore?
Yeah, very.
Okay, well, that's the advantage of the needle, is that a lot less pain, but a lot more success. Okay, so you can see that the skin is going white. So this is mostly local infiltration. We can pretty much start straight away. So what I'm going to do, I need the cryo gun, yeah. I'm going to pare this down. Now you can expect quite a bit of bleeding. So we usually use aluminium chloride. It's 20% aluminium chloride. It's soaked in cotton buds.
Okay.
I'm going to pare it down here. Just tell me if it's sore, Killian.
Okay.
Okay. You feel that?
Yeah, I can. Yeah.
Is it very sore?
No.
Okay. Feel a bit of pressure?
Yeah.
Okay. We can get that in a minute, Caroline. It's fine.
Okay.
I'm going to pare down a bit more. It's very important with cryosurgery that you make a confident clinical diagnosis to make absolutely sure that you know what you're dealing with, but there's absolutely no question here but that these are just ordinary viral warts in the typical part of the body at the typical age. So I'm going to pare it down as much as we can. So now we've got rid of probably 90% of the wart there already. Just be careful with your sharps, but there's quite a lot of bleedings. If we try and freeze that now, it's just going to bleed everywhere, so we'll just use it. You can see the amount of bleeding that's there. If we use some aluminium chloride, open up the hand, Killian. That's it, good man. You feel anything? Okay. Aluminium chloride usually stings if you don't have anesthetic, but obviously he has plenty of anesthesia here. But this is absolutely fantastic for stopping the bleeding almost instantaneously. So you can see it's stopped already. Now we've debulked and we've scooped out the wart, so pretty much 75 or 90% of the wart is already gone. So all we have to do now is freeze the base. So I'm going to take off my glove because it's blood stained and just get the cryo gun and just freeze this. A bit cold, Killian. Yeah, can you stick it? Okay, freeze it until it goes white and 2 millimeters go white, and then we keep it going for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. So that's a 10-second freeze, 1 freeze-thaw cycle. I'm going to let it thaw out and give it a second freeze-thaw cycle to make sure that it's completely gone, right? The ones around the nails, the periungual warts, we tend to be a bit more gentle with the freeze, maybe 5 or 7 seconds, sometimes only 1 freeze-thaw cycle, because if we're too aggressive, as I mentioned, we might damage the nail. So we're going to let this thaw out and then just a dry dressing, a little bit of tape. Open up, please. That's it. Is it sore?
No.
Feel anything?
No.
Good. It's a lot easier, isn't it?
Yeah.
Yeah. So the pick at the start is sore, but makes the rest so much easier, but also a lot more successful. That's thawing out now. It's nearly ready for the second freeze. You have to let it thaw out completely. Sometimes it might start to bleed a little bit. It's not going to bleed here because the aluminium chloride is still working. So the same again. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Now we're going to do the periungual warts. You right so far, Killian?
Yeah.
That was the biggest one, right?
There's one on both sides of that one.
Yeah, but I think it's all just around the edges here. So I'm just going to pare this down. Get as much as we can out with the scalpel. Obviously there's local anesthetic in here, so he wouldn't let me do this if there wasn't local anesthetic. These ones, the success rate isn't as high, maybe around 75% with 1 single treatment, but I'd rather have to go back twice than to overdo it. Trying to get rid of most of it with the blade. So is that sore?
No.
Okay. Nearly there. Again, there's a lot of bleeding because in this case we didn't use any adrenaline in the local anesthetic on the fingers and toes. We try and avoid adrenaline. Again, we just try and control the bleeding. I need more of these, Colin. So 20% aluminium chloride. The easiest place to get that is anhydrol forte or dry chlor, which are antiperspirants. And it stopped the bleeding almost instantly. Do you feel anything?
No, a small bit,
Yeah, okay. If you had no anesthetic, that stuff we're using to stop the bleeding would be quite stingy. But the anesthetic saves all that. Again, maybe this time it's more like a 7-second freeze. So 1 and 2 and 3 and 4 and 5 and 6 and 7. And I think I'll only do 1 freeze-thaw cycle here. So this was the very first one we did. Open up the palm again. And just 1 more band-aid, please. Okay. Band-aid, yeah. You right, Killian?
Yeah.
Good man. Have we got a collar and cuff? Just 1 more piece.